I'm okay with it because I think it's important for for us to understand how Paula has come up with, her thinking about this.
Absolutely.
Because she did that
Okay.
extra work. Yeah, I'd love to hear it.
All right, so it's called the 3-year shelter study, recommending a major design of the emergency sheltering system, written by outside consultant Mary Chapman Simple. So I'm just starting in the middle. System design, can you all hear me? Is my voice loud
Very
enough?
well, I can.
Okay.
And I'm hard of hearing.
System design theory suggests that every system is perfectly designed to achieve the exact results it gets. Considering the results, over half of the homeless population in Denver is and has remained homeless for a year or more, according to a 2017 point in time contact. Denver must rethink its interconnections between shelter and rehousing activities in order to obtain different results. Sheltering becomes a means to a rehousing end and not an end itself. This is a fundamental paradigm shift that creates a shared mission and responsibility for both providers and clients to achieve rehousing, not just provide a shelter bed. And this paradigm shift takes root. The behaviors of providers and clients will shift in tandem, coupled with a shared database to identify pathways, prioritize and connect rehousing interventions, and track progress and outcome of individuals across the entire homelessness response system. And a massive infusion of new rehousing options form the implementation of the city's 5-year housing plan and affordable housing fund. All partners, providers, and consumers need to understand the intent of the system, desired and expected outcomes, and how they should interact within the system to produce the result. This vision should compel action toward that end every day and serve as a North Star throughout the system transformation process. If the collective impact outcome is a rapid, successful exit from homelessness, then all activities and investment should be aligned and scaled to achieve that result. Today, investments and activities across funders and providers are disconnected and driven by individual interests rather than a clear collective outcome. Couple more. You have to use the homeless management information system, which I think the management action plan pays almost no attention to. HMIS is critical to an effective homelessness response system. One more thing, coordinated entry is so important. Is the only way to achieve each and every rehousing option is used to its fullest potential and achieve an actual reduction in homelessness. It is also the only way to ensure the chronically homeless, medical frail, disabled, and senior populations can exit the shelter system. It is tempting to give in to the idea that there are so many in need that we should serve whomever is in front of us or who a provider believes will be successful. But that approach has not borne out over time as an effective method for reducing the numbers of individuals and families experiencing homelessness. Instead, forcing prioritization and matching rehousing options based on need ensures those otherwise left behind get housed first, and that everyone receives just enough rehousing service to be successful. Coordinated entry is far more precise in its matching than standard first come first serve wait lists and screening practices that are designed to protect assets at the expense of denying housing and vulnerable people. Yay! So anyway,
Wow.
That's what I read.
Restate that where you were reading from for the recording.
What's the link? Or can you send us the link?
Let me just read it again. It's called it's mentioned in the action item. If you go to the table of contents, the very first item on the table of contents is setting the,
Stage or so, no, setting the, I
set,
got it.
I said it a minute ago and now I've forgotten it.
Table, wait a second, laying the
Foundation.
foundation, laying the
It's under,
foundation.
it's in the table of contents under laying the foundation.
Right,
And it's a 36-page report called 3-Year Shelter Study.
okay, thank you.
3-Year Shelter Study. And so you have to click on it and then you get it from Mandy Chapman Simple, SEMPLE. But a lot of it is charts, guys. The narrative is really not that long because she goes on and on and on about exactly how to set this up. I mean, I was just absolutely stunned by it. Anyway.
And can we talk later about, there's a possibility that I'm going to ask for your notes if we're going
Okay.
to do something jointly, and that may not be
Okay.
appropriate. So I'm moving on to solutions the way I sometimes do, so back me up.
Okay. All right, thank you for
Deb.
letting me read that.
Deb, could you just voice some of your feedback for what Paula just said?
Yeah, absolutely. Oh, Pam has her hand up. What is it, Pam?
After Deb, I would like to speak about some of the things I observed and learned when I was a volunteer for several years at St. Francis Center in their social services office.
Okay, Deb, go first, and then Pam.
Yeah, great. I did not read that report, so I appreciate the summary, Paula, of how it was meaningful to you. And I do want to go back and read it now. What I have heard again and again and again is that Denver recognizes that we have a huge need to create housing and retain the housing that is affordable, but no plan. And so what I have experienced since the beginning of the pandemic is so much more of what you read about, of the different agencies coming together with the city to talk about, what this one is doing, what that one is doing, what the needs are, and being so much more coordinated than they have ever been. And so friends of mine who run nonprofits, shelters, day shelters and overnight shelters have said just how much better things are now that they are all working together. But before this host plan, we didn't have it broken down into doable steps that everybody agreed was, a way to approach it. And so I couldn't be more in agreement with the idea that shelters were never initiated to be long-term housing solutions. But because the city, mainly, we didn't have the political will to do anything different than just expand the services of the shelters. But now it does seem that we have the political will. And I think that the reason that 2B passed the way that it did is because Downtown Denver Partnership got behind it. Because they now understand that homelessness in the city affects them too. And that
Absolutely.
they need to be behind solutions to help people to not be living on the streets. So I'm very encouraged right now with the passage of 2B, and with that being able to go hand in hand with this action plan. I love action plans, and to be able to break it down into 5-year and then refine it into 1 year, it gives us the opportunity to have a lot of people weighing in on the success. After a year, we'll just see if we're headed in the right direction or not. And then I think we'll gain some real momentum after that.
Yeah, good.
Thanks. Paula, could I have Pam go ahead and say something? And then I'm going to ask you to respond.
Yeah.
Okay.
Yeah.
Pam.
Yeah, at St. Francis Center, when I was working in the social services office, and I just stopped, in March because of the pandemic
Yeah.
and being old and fragile.
Yeah.
But yes, we were basically a first come, first serve. There was a list outside the door, you sign up, you come in, and the people who worked in there were wonderful in the sense that if it was 5 minutes, it was 5 minutes. If it was 45 minutes, it was 45 minutes. They totally focused on the person and the situation and so on. But my job was to specifically work with people to fill out applications for apartments. And what I learned was that 1 year is the exception. I mean, the waiting lists are much longer than that. And it was just terrible. We do not have enough housing. I mean, that's just the bottom line at the subsidized and supported levels. Because I saw people in there who were older than me, people in wheelchairs, people with mental illness, obvious mental illness, and they got exactly the same lovely treatment, being treated as everybody else, but they had to put their name on the list. They had to sit down with somebody. They had to leave. I mean, it was doing as good a job as could be done within the limitations. However, I do want to say that HMIS, the year before I left, they hired a full-time person specifically to develop and work with HMIS. So that's in the works. It was in the works then. So these are not things that have to start from zero. Even though what I just said sounded dismal, they already had the concept, the plan, and they had hired a person specifically to be the to be the HMIS person. They also did have coordinated entry. We're working on that. And there also is a coordination computer connection thing called One Home. And I didn't work with those specifically, but I just want to say that they were already in the works within the shelter system. So we're not starting from zero. So I'm trying to balance these two realities. One, I always want to speak up for the suffering of these people. I don't ever want us to feel, to congratulate ourselves that, oh, we're doing so well, because these people are still living on the streets and these people are vulnerable. But at the same time, I want to really, encourage us that we're not starting with zero.
Well, the two of you, Deb and Pam, know what you're talking about. I don't know what I'm talking about. I'm just new to this. So I'm so glad you're going to read the report. Maybe you'll just think you might think it's pie in the sky. I don't know.
Oh,
but anyway,
no. It's a guiding light. It's wonderful.
So that's all.
You got to have a goal. Absolutely.
I agree. My guess is that they did the consultant work there and they got the report. And that was, it was mentioned in the beginning of the plan. I feel like it was a huge guide for them to be able to say, this is where we need to get, right?
But you said earlier, Paula, it wasn't obvious that it was a guiding light.
I think it is not a guiding light at all. I think they've done nothing that this report suggests. Now, of course, they've got a data system, but I don't think if you read the report, it's a completely different concept than they're using. And maybe, there are reasons for it. I'm not blaming them or anything. And I absolutely don't know what I'm talking about. So you guys who are informed need to read the report, is what I would say.
I will, but I think that the points that you're bringing up are good questions to ask.
Yeah. Okay,
and it could be that because it was written in 2017, that, there are new best practices, especially because of the nonprofits that are all working together with the city. We may be further down the line. And so they're looking at a different system. But I think
that's very true.
Your questions are really appropriate.
Yeah.
Excellent.
From the action plan, you can't tell that they're using it, or I couldn't tell.
Yeah.
They're using it.
And did you read that off that you couldn't tell? Was that in your notes or was that just in your comments?
That's in my comments. I should put that in my notes.
If you could put that in your notes, All right, my head is let's keep this in mind as we at the later, just a bit later, talk about, so what are we going to do with this? What is Paula just going to do exactly what she is saying when she fills out the survey? Because she has her notes and she can simply send it to them with her survey, and that's one really good thing. Or do we all get so invested in what she's drawn our attention to that we want them to know that it came more from an active group who are saying, love this, let's do some of this, but keep in mind, did you pay enough attention to this guiding light? I don't know. So, thank you very much, Paula.
Welcome.
Okay, so the four of us are just now really taking a look at something that we will be talking about here with some slides. And that is that we committed to that we would really do our homework, and we would answer some questions, and we would rank order those strategies that are in the plan ourselves. So there were 5 people in the rank ordering, and that it's the 4 of us plus Mary Beth, because Mary Beth had to go out and have some fun with her family this week and can't be with us. So she did it that way. So for us to just take a look at, first of all, there were the questions 1 through 7, and no one sent feedback to me saying that we don't strongly support what was in. So I, in terms of us, this small group, we don't have anything that's saying that we would not strongly support from just us. And I don't want to make a big deal out of that. But let's look at question 8, and Joan can put that up on the screen.
Yes, I can.
And that's, what else would you like host to know about the action plan from the review that you did? So, so let's go back to 8.
Yep.
Yeah, and that I just read off the question. So Paula, we're looking at the answers that came from myself and Deb, and we'll focus mostly on Deb. Can you put the answers there, Joan?
Yes.
Yeah. So I put in all I put in there in terms of what I considered important for them to hear was getting a credible data system for assuring accountability and communication of results to the public is crucial. And just as an old bureaucrat, I just, on this front end, whatever we learn in this 1-year plan from the perspective of how do we work from a good data source and how do we communicate it to the public, I think is crucial. And then Deb, could you talk through the things that you responded to in terms of this 1-year plan?
Yeah, absolutely. So the first one totally relates to what you highlighted, Jan, because I think that we need to build some credibility among the community, that the city and the nonprofits are working together, number one, that we are making good decisions and spending money wisely, and that we're making a really significant impact, like the synergistic effect of the nonprofits and the government all working together. And also I would lump in there the way that the government and nonprofits are working with developers and those opportunities for expanding housing. One of the things that I so appreciated when I read the report under the overall strategies was that they laid out the use of person-centered, trauma-informed care. So, we've been working at Trinity on how we connect with people who come in from the community, and how do we recognize the way that trauma has impacted them in their situation, and how can we best respond to them without reintroducing the trauma and how to care for ourselves at the same time. So I really appreciated that they brought in the trauma informed and the lifting up the dignity, because as people of faith, that's what we're all about, is recognizing God in others. The second one, I did not see when I read through a mention, or at least it wasn't strong enough that it registered with me, of how Denver will work regionally or even across the state in these goals. So when I lived in Broomfield and started a nonprofit there that brought the churches all together working for affordable housing, we first started doing that work because we recognized that people who were falling into homelessness in Broomfield were being shipped by the police department to Denver.
Ah.
We did not have an emergency shelter. Our community was, homeless people in Broomfield were invisible when we started working on it. And it was a travesty because it would be a person, typically a person with some kind of a mental health struggle, who couldn't keep a job and went through their relationships where nobody wanted them to live with them any longer. And so they would be on the street, and so they would get put on a bus to Denver. And that meant that that person had to start completely over building any kind of supportive network. And it was just so not dignity filled to ship people like that. And so we know that during the pandemic, nonprofits across the region have had to close because they have not been able to keep open. I'm specifically talking about shelters. And so we have seen a huge growth in the number of people who are experiencing homelessness in Denver because they have come in from across the state. And the work that I did in Broomfield, the work that I've done across the state through that group, says that housing needs to be addressed regionally. And so if nothing else, I think that there needs to be some kind of a regional council where everyone can know what the other is doing and support people staying in their community. And then the last thing, I just think it's so crucial that we do make an impact in this first year. And as we all know, the growing number of people who are living on the streets in tents is just astounding. And so I said a 2021 focus on stable housing for residents earning 30% and less area median income and retaining our existing affordable housing would have a huge impact. So that's just kind of lifting out of the options what I feel would really demonstrate some progress for the people who are hardest hit during this time. And so before getting on this call, I just quickly looked to see what the area median income is right now. So right now in Metro Denver, the individual area median income is just over $65,000. And so before the pandemic, the need of housing, because the guidelines are that you should not be spending more than 30% of your income on housing. And that's actually the definition of affordable housing, is that you're not spending more than 30%. And so we had people who were extremely cost burdened spending more than 50% of their income on housing before the pandemic. And at that point in time, we were finding that people who earned at 50% of the area median income were not able to find affordable housing. And so that number has just crept up and up and up during the pandemic. The last project that I was involved with, building some affordable housing in Broomfield, was a Habitat for Humanity project where a church donated some land to build 4 townhomes. Because of the cost, they ended up having to set that up for people who are earning 80% of the in income because it's so expensive to do development. And so you can see that gap. So 30% and less is mainly people who are disabled and cannot hold a job much more than something
Right.
that's, like an hourly job. And we know that that doesn't have enough income coming in. So 30% and less is generally people who are disabled in some way. And then above that, it's the school teachers and the therapists and the people who work in churches. And so that goes all the way up to 80% now because it's because of the cost of housing and because of the way that income has not kept up with housing prices. So that's why I made a big deal out of 30% and less.
Thank you. Okay, group, any comments that you would like to make in terms of this this set of information in as an answer on the survey to question 8? All right, let's go to question 10. So then building from that, then what advice do you have for the 5-year planning process? So moving to the strategic planning, I stayed with the data systems piece. Making this just this major opportunity to really do the best job during this first year of addressing the data and the communication procedures and having a way to look at that system to see where the flaws are as a key method for making sure you don't have a comprehensive, quote, 5-year strategic plan that doesn't have this credibility. So Deb, then you had the other 3 bullets.
Yeah, and I've really talked a lot about the first bullet already. Collaboration with nonprofits to assess need and apply best practices to serve specific groups of people towards stable housing has added much to the value of the draft plan. And then ongoing cooperation expands the breadth of solutions possible. An example of that is the hotel conversion that Colorado Coalition for the Homeless did in the last few months. If we depend on the city to do everything, it's just not it's gonna be slower than if the city is able to help with funding and the zoning and all the different policy that they can do to empower the nonprofits and even churches to do more housing options that can expand the development to reach the needs much quicker than if the city's trying to do it all. And then creating, yeah, Pam?
I just wanted to give an example is the safe outdoor spaces, what's happening right this moment, where specifically because of a zoning change, we have 2 churches, one in our neighborhood, one in Uptown, that are ready to stand up a SOS. And they're hoping to do it by December 1st. So that's just an example.
Yep, great. Okay, and then creating more pathways to stable housing. And Paula mentioned that there was in that report about expanding those pathways so that when somebody falls into hard times and they end up in the shelter, they're not staying there, but there's different options for where they can move into housing that's appropriate for them. And as we all know, I don't own a home right now, but I have owned a home, and I worked in real estate before coming back to work in a church at Trinity. And we know that the greatest pathway to wealth is through home ownership because of the equity that we earn and because of the stats that show the discrepancy in home ownership between white families and families of color. We see that there is a growing wealth gap for Black and Brown communities because they don't have the same opportunity for buying housing as, in general, white families do. So it's really important that we have an equitable perspective when we're looking at home ownership and helping people into that security. And then And then I'm talking about for residents earning up to 60% AMI because of what I mentioned earlier, that there aren't enough options for people to buy at that price range. And the count, the point in time count is only one night in January when people would tend to be inside, not outside. And that count does not include people who are doubling and tripling up, sleeping on somebody's couch. It's only people who are outside or sleeping in their car. I think they included sleeping in the car as of this year. And so we have much more homelessness than we even know because of families that are couch surfing from house to house to house to have a place to be inside, in homes that were never designed to accommodate more than one family. And so we know that this is devastating in family systems. The abuse, the lack of space for children to do school, there's just a lot of implications for the doubling and tripling up. When I used to work at the Container Store part-time. I love organizing, and I used to do demonstrations for people that would come in on organizing, maximize their space and time and efficiency. Jan understands because we're both 3s on the Enneagram. But anyway, one day I was at the Container Store working, and I was on the bath aisle, and there was this trio of young adults, 1 male and 2 females, and they were looking at shower things, and I asked them how I could help them, and they were trying to figure out how to set up a shower in their car because they were living in their car and they didn't have a way to take a shower.
Wow.
This is an affluent
Oof.
Broomfield.
I mean, did you come up with something, or was it, I'm sure that was an interesting discussion.
Well, I happened to be connected with a church that had a gym and a shower in Broomfield, and they open up their facilities. I think it's twice a week for anybody who needs a shower. So I was able to connect them to that.
Oh,
And I said
that's so good.
And I said to them, we're not supposed to have to figure out how to make a shower in our car. There's something wrong with our system when that's what we're left with. And so I asked them if I could share their story, as I've shared it quite a few times. And it's stunning for people to think about that, the reality that is for folks. So yeah, the last one is, what are the regional
Oh, could I ask?
which is the same one that I had in the first. I just wanted to repeat it.
Thank you.
I have a
Pam?
I have a question about the third one. With that word equitable, does that have anything to do with race?
Yeah,
Specifically? Yeah.
Well,
Because
equitable,
it's easy, it's broad. So it's, one of the things historically with racial non-equity has been to blend it in so that other people can, so that the people who wrote it may have had that in mind, but people who come along later may not. And, and so it becomes sort of diffuse and not, anyway.
yeah, well, I don't think it is limited to racial equity. I think
No,
it's.
of course not. Of course
So,
not.
I mean, not in this context. I wouldn't put racial in there, but we do know, we do have the data points, and they were in the report that talked
Right.
about the inequity, racially, and also, just gender wise, it's not been that long since women could actually qualify for a mortgage on their own.
Right.
True. Okay, we have this information that we are providing as feedback to the folks who are asking for it by November 9th because of this plan being a draft. Are we as a group together today comfortable with some of the feedback that we are providing to the host developers? Is that a yes?
Yes.
Yes.
Okay. Paula, now,
I'm comfortable.
We're going to come back to that in just a moment, but there is a drum roll because we're moving to the way we kind of started this, which was you've got a whole list of 19 strategies within the survey, and how do we make sense out of those? And so for us, that was kind of the thing that framed how we came together to do our homework and have this session today. So Joan, could you show the rank order?
Yes.
And then don't let me forget that I wanted to bring up the op-ed that was in the paper 2 days ago from Kanish and how it relates to what we came up with. Okay, so as I put together the information that thank you for making that where I can see it. The information that each of us had done separately. We each did our top 5, and this is what we came up with. This is Mary Beth and then the 4 of us.
Okay.
So the highest ranking one, each one of us chose it separately, is this transformation of the shelter system for persons experiencing homelessness through conversion to 24/7 rehousing focused operations. And I'm going to go through the rest of them and then we can talk back through them. And then the one that came right after it, number 6, 4 out of the 5 of us, strategies to support those experiencing unsheltered homelessness. And then the third ranking was 3 out of the 5 of us, prevention of eviction and foreclosure in terms of things like legal assistance.
Mhm.
And then there were 3, so we're not doing a 5, we're doing a 6 of these. There were 3 related strategies that at least 2 of us mentioned. And first of all, so it's 9, 11, and 12. So strategies for use of land to support affordable housing, city-owned land, and then what does land banking mean? Is that just
Land banking.
it is land banking? That really was just a typo on their survey?
I think so. Don't you think so,
Okay.
Deb?
I thought
Like a
surely they
community.
wouldn't have let it get into the survey with it
Don't
being
you
a
think
typo.
it's land banking, right?
It is land banking, and I think it
Okay,
might
so
be
that was
tied
just their typo, and I will change that so to their typo.
land
So
banking.
it's those versions of the way to use land, and then strategies to preserve existing affordable housing units and strategies to support equitable access to home ownership. Those were the 6 that we came up with. What do you think once you see them right here in front of you? And I'm asking that as a group.
Yeah, I think they're great.
I made a mistake. When I sent mine in, I dropped 7. But
Okay.
nobody else put 7, huh?
Wait, but I don't think I have the sheet of paper in my possession that
I have
would
it.
help.
I have
But
it.
I kept track of who said what. Oh, you had it?
I have it. Do you want me to read
Okay,
it?
so then there would be 2 of you.
No. I just thought you
Oh,
wanted it read so we knew what we were talking about.
okay, give me 7.
Expansion of rehousing pathways for persons experiencing homelessness.
Oh, so that fits right in with your comments, Deb.
Yeah.
Yeah. So, and that was going to be a question I was going to ask. So after you look at each one of these, just what Deb did, is there one that you can't live without that we need to add to this? And would you like us to add that?
I think we've got to put race somewhere. I don't know where to put it, but I just feel like we need to somehow do that.
Okay.
Well,
And
that's
Deb,
what I thought was in 12, right?
That's what I thought. It looks like it's in 12.
well, why
Yeah,
can't
but
we?
like I say, the word equitable could, is so broad. I don't know. I just
Then
know
can-
how equitable
we
can have to
Ask for a
do,
parens.
Unless
A
if it-
parens after
at least-
equitable.
at least have a list
What?
I just feel like we're at a moment in history where we just need to keep harping on that one string, because right now people are actually hearing it. And I know that there are times when people don't even hear it at all, many times.
What if we added that as a comment, like we did up on number 8 and 10? Just be very specific that we mean by equitable access, racial equity.
Or including racial equity.
These aren't ours to change.
I mean,
I think you're right. But yes, so we could put that comment in both 8 and 10 or not?
I think so.
Yeah, I think
Okay.
so.
Okay. Race in both 8 and 10. All right. But otherwise, Joan, what do you think, looking at what we ended up with?
You know, to be really honest, since this isn't my area of expertise, in the very least, I'm learning so much from y'all. It sounds very broad. It sounds wonderful. And it's like you could probably put 50 points under each one of these to make each one of these happen. So to me, it seems
Maybe too broad. Okay.
I don't know, but I'm not as well versed as y'all are in writing these types of strategies. I used to be, maybe when I was a working person, but now I am. But also then when you list things like this, we used to have to, in nursing, we used to have to say as evidenced by, and how you would prepare all of these. And so that's where I feel like, and I felt like even with the 19 that they came up with, that there's a lot of work to be done. And did they in their program do as evidenced by for every single one of those points? How are they going to have all that? That's just my opinion, and thank you for asking.
All right, Pam, what about you in terms of what we've come up with?
It seems like the first thing I noticed when I read the 19 was that they were from everything from, what I would call grassroots on the ground. That's the transformation of the shelter system, providing mental health care for people who are home. Those are things, specific things that should be done like that. But then there was the middle range, and then there's a policy range. And from 9 to 19, they're really all policy. And there were very, let's see, and then there were a couple in the mid-range, what I would consider would be things like rental assistance and, the prevention of falling into homelessness, those kinds of things, people who are at risk of falling into homelessness. So they're sort of serving the homelessness, at risk of falling into homeless, and policy. It seemed to me like they sort of fell in those 3 categories. And so as I'm looking at them, I at least want one in each of those areas. And I think we definitely have those. Yeah, there's one in each of those, because preserving existing affordable would be in the mid range, and 9 and 12 are broader. And
They
the
are,
others
yeah.
Yeah, so that was the only thing. And I know they all sound, I can really empathize with what you're saying, Joan, about it all sounds so broad and so big. Like, where do you get a string to pull? but it's like on those 3 levels, it's like you can, it's not going to work at level 1 if you don't do level 2. It's not going to work at level 2
Yeah.
if you do level 3, and it's not going to work at level 1 if you don't do level 3. So, you know, it's a whole
Yep.
thing. So I think even though it sounds impossible and huge, we've got to try to make sure something is happening in all 3 areas.
Mhm.
Anyway,
Thank you.
that's, yeah.
And Deb, I wanted to start with, would you be pleased if we added 7?
Yeah, because that is the pathways one. That is the expanding the different
Shall we
options.
pull up the 19? You need,
It's expanding rehousing pathways for person experiencing homelessness. Okay.
Because that's
Can-
the only
can-
way to get people out of the shelters.
Yeah.
I do have a couple of, I have a
Yeah, and
couple-
are people okay with what we've said so far?
Yeah.
Okay, Deb, go ahead.
yeah, so I just wanted to speak to kind of the way I looked at this, and it's helpful to hear Joan and Pam talking about how they looked at it too. I would look to the state to provide the prevention of eviction and foreclosures rather than asking host to do that. And so I would write that in as a comment on 8 and 10. And just keep looking to host to providing the actual mechanisms of the housing. And then that 11 is more important than I ever knew. Because once you lose existing subsidized housing, you can never get that back. You have to create new, and it's more expensive to create new than to maintain what you already have. And so I would also look at number 9, the strategies for the use of land, as something host needs to figure out how to do that on their own on the way to creating these pathways. So that would be like zoning. You know, we could call
Right,
out zoning as
right.
something we need to work on, but if we're saying we want the SOS, and then the city's like, but we don't have zoning, oh, we need to get zoning so that we can do SOS.
Exactly.
And so I keep going to the end result and entrusting with them making the policies and the strategies to get to that end result.
Right.
Thank you. Thank you.
I'd like
Okay.
to say a word
Yeah.
for just
Pam, and
how
then I'm going to ask
How-
Paula to react. So Pam, go
How
ahead, and then I'm going to ask for Paula's input.
Yeah, how important it is to go to the 24-hour shelters, because it's impossible if people who are homeless are not going to be able to access the systems they need, 1, to be healthy, 2, to get rehoused, if they don't have consistent place to be where they can be found. And so when they're hopping around from place to place, all their energy is at the survival level. Just got to survive. So this is so critical, because even as solid as St. Francis is, and it is solid, their people had to come in by, they had to choose to come in. So they had to be having a good enough day so they could get themselves from wherever they had to sleep or not sleep the night before into the place, and then meet with somebody. And then they had to go back out and do it all over again. I just can't say enough of how important that is. At the other, it's sort of like Deb's talking about one end, and I'm talking about the extreme other end, that both of those, for the policy to work, you got to be able to access the folks too. So that I'm real, number 5 is really, really important. And I think they're emphasizing it. So
Go ahead.
that's all.
By the way, the report that I was referring to speaks extensively about the horrible transportation system that the sympathize with that. It goes into that hugely as a big problem. That's what I'm saying. So I didn't see these strategies at all. I guess I was referring back to that other report and didn't, so I don't have any comment on them except that did this action plan talk at all about mental health and addiction?
I agree on that. Let's cover, by the way, we're 5 minutes of 12. And if we could stay together until about 5 minutes after, I think that would be kind of what I'm asking of you. Is that okay, everybody?
Yes.
Okay, Paula, go ahead and talk about mental health. And is that obvious in any way in what we've focused on?
You want me to pull up the 19 points while we're talking?
If you want to, sure.
I don't know.
I read that number 5, the transformation of the shelter system for people.
Me too.
I
Me too.
read that as including services, the 24/7.
And it's oblique. It's a little bit oblique, but that's where I thought we had it. But should we put within the comment section for at least 8 something about being sure that
Yes.
we address that we bring to the fore the emphasis on mental health. Is that okay?
I think that that's
All right.
an important thing to do. And I do think
Boy,
that
it looks
will
like we're,
actually-
oh, we're good. I'm sorry.
You-
I thought we were closing.
You people know, and I don't, but I thought that mental health and addiction just affects such a large number of people that it just seemed to be omitted entirely, but maybe it was there, but that's where we really need to spend the money, I think. The other,
Here.
I don't want to take up too much time because you all are the experts, so.
Fresh pair
Go
of eyes
for it.
is really valuable.
We've learned a ton from you today, Paula. Stop that
Well,
stuff.
What was I going to say? Oh, I thought host was supposed to be, first of all, I thought they were supposed to be getting money from these other agencies and that the other agencies had to have public meetings and sort of oversee the money from other agencies. I don't know where I read that, but I couldn't find it this morning. But they make it sound like, I think in this action report, that they are just conferring and assisting and supporting these other agencies rather than having an oversight role with them. And so I was wondering about that too.
What do you know, Deb?
What, could you be a little more specific about what you mean when you say other agencies?
Well, I'm sorry, the groups that are funding homelessness in some way or other. I mean, there's so many city agencies that are doing it, so many state, so many local philanthropic. I thought they were supposed to look at all that money coming in and sort of determine its, I'm not finding the words right now, but overseeing it, I guess. I guess maybe making sure that there wasn't any fraud and abuse from other city
Right.
agencies or state or so forth. But that didn't come across to me in this action plan.
Interesting. Well, you know, host is new. That is the new name for the Department for Health, stable housing in Denver. And I think that they're still kind of working around, like, how's the money going to come into that and how do they access all of that? So maybe there is a comment to add about some kind of a transparency about the funds that they are accessing. Because some of it is state, some of it is federal, some of it is local. And I don't know clearly how that all works together.
They probably don't either at this point, maybe.
Okay, I need us to quickly, let me just ask the four of you, Was this a good discussion or what?
Yeah.
I think that,
Excellent.
I
this was
enjoyed
so
it.
good. This was so good. All right, what do we do with it? What, and we don't have much time to talk about it, but what are our next steps? Because something's due November 9th. Are we each going to be sending in our own survey? Yes?
Did.
Okay, so we'll each do that. And Paula, whatever you want, whatever you can put into that survey, go for it.
Okay.
Now, will we do something jointly? And I want the answer to be yes.
The answer is yes.
Whatever you say, Jan.
Yeah.
Yes.
Okay. Yeah.
Yeah.
Okay,
as-
push back.
I'm still,
'Cause I will state what I want, but yeah, what do you think? Would it be helpful? I mean, will it make a difference that we look at what our allyship group came up with together for what we consider to be the critical issues within the 19?
yeah, because right now it's just words.
Is this to,
Simple words and
Yeah.
simple intent, but then what are we gonna do?
is this to submit to host if, to what other entities as well?
I don't know. I think the fact that we are a group and that this is what we thought of this report is valuable. Even
Absolutely.
if nothing gets done about it, it's what we as a group came up with as, it's kind of like our value system. So I think it's important to mark that. That's my opinion.
I agree with all of you. I think it's a really good practice for us to discuss these, what we've done today. Thanks for the idea and thanks for facilitating it, Jan.
Yeah.
And I think that because we all live in different districts, and so we're sending our survey to different council people, it makes great sense for us to compile a communication to, how about Chris Hines as the council person for Trinity, since we're a Trinity entity, and also to Robin Kniech, because she is our at-large connection that we're closest to, and help them see the work that we're doing in the community and help them be appreciated for the work that they are doing by our participation. Our call next week that Pam's doing some work on right now is our connection with Chris Hines and Chris Hines' office. So this could be really good timing for us to, let them see our work together.
And it gives
Absolutely.
us credibility.
And I do have notes on my piece of paper of what we said we wanted to do to fill this out and adjust it a little bit before we would send it off to anybody. But now tell me that my individual survey, who's it going to?
When
Host.
it goes to host, but when you can complete it, you indicate who your city council person is.
Okay, that's what
But
you're
I
saying.
don't know that, I'm assuming that they'll get a copy of it, but yeah, it goes to host. And, but it makes sense that we would send it to city council, right? Our combined one. I mean, that is right. The power of an allyship is to get our voices all together saying the same thing for advocacy, because that empowers city council and government to act on behalf of its citizens.
So that's going to happen. And I don't think we have to, we don't have to make it perfect for how it's going to happen in this conversation. But the other thing that we've committed to, Paula, is that we will each read the 3-year shelter study that you brought back to us that we haven't
Yeah.
read. So yes, we're committing to that. Okay,
Don't
guess
read
what?
it.
I'm handing this over to you, Deb, not the putting this together, but ending this meeting. Could you end this meeting for us?
So thank you all. It's been incredible during this time of the pandemic that we could keep doing our work, and that our work has become even more defined during this pandemic. And I love doing it with all of you. And I love seeing this as a ministry of Trinity. So thank you for being involved in this, and hope to see you next Thursday night when we do our next call.
That's.
And everybody keep your
week from
fingers
today.
crossed. Some things
Oh,
that
yeah.
need to happen are gonna happen.
We do. Yeah.
Yes.
Coming.
We'll do it.
Thank you, guys.
Thank you so much. You made this meeting really worthwhile. Thank you.
I learned so much. Thank you all. Thank you.
God bless.
Bye-bye.
Bye-bye.